Hi, good evening, and I welcome you all and congratulate Dr. Sudeep GC, whose AIMS Merit List rank 3 and Common Merit List rank 4 for INISS October 24 for branch of DM Cardiology. Congratulations, Dr. Sudeep, and welcome.
Thanks a lot, sir. Thank you.
So Dr. Sudeep has done pretty well, and he's one of our bright students. I always knew some of the students always fare in top 10 in the Grand Test series, so we know. And actually, Sudeep, when Srujana called me, she said, "Sir, can we do interview for rank 1 1?" I said, "I know one more student who's I expected to be there in top 3, so wait." And then you text me. So you can
Yes,
ask my backhand team. I knew that you and one more guy, the other guy came 13th,
yes,
but I knew that two or three guys that who are going to be there in top three. That's the confidence a teacher has in a bright student like you. So I told
thanks a
them,
lot.
wait, I'm going to get a rank 3 also, or 2, or maybe 4, but I'm
Yes,
expecting one more guy to be in top 5. So good
yes,
to see you because your preference. I remember you were doing great in grand test as well, Sudeep. Am I correct?
yes, sir. Yes,
Yes.
I attempted three grand tests. I had got around
Yes.
5, 12, and 7. Yes,
Right. So that's the reason that I always thought that you should be doing well because pretty much it mimics the pattern and the book-based questions that we have taken pains to prepare.
yes,
So, Dr. Sudeep, where are you from? Undergrad and post-graduation, where have you done from?
yes, sir. Undergraduation I have done from Kasturba Medical College, Manipal, sir, and post
Okay.
graduation I'm currently pursuing it at PGI Chandigarh.
Right. So you'll have choices to choose, best of the best institutes to choose with your rank. I'm sure you're going to get the
Yes.
seat that you want. So, when did you decide to do cardiology, Sudeep?
Cardiology, I was inclined towards cardiology right from MBBS, sir. But
Okay.
I definitely decided it during my second year of PG. So that's when I thought I'll take up cardiology because I used to like taking cardiology cases and seeing cardiology patients. So that's when I thought I'll take this up. I was sure of it.
Right. So what was your strategy? How did you start preparing in your MD now that you already knew, I mean, in your heart of your heart that you want to pursue cardiology in MBBS? So as soon as you got Harrison, that probably the same time you bought Brunwald as well?
Yes, sir. Bought my Brownwall in the first year. Though I didn't
Right.
get much time in the first year, I did study parts of it whenever I got some time. And especially from the exam point of view, I looked at the charts as well as the images. And I started preparing for the INISS from when I had my cardiology posting in the month of March or April. So that's when I
Okay.
started definitely studying for it with the intention of the exam as well.
Okay. So Dr. Sudeep was full course subscriber. So was not only part of the videos and syllabus, but also part of the doctoral's question bank and the grand test series. And then there's a free WhatsApp group, which everybody is allowed to be part of. And of course, the mock interview. So we'll come to each one of them one by one. If you can just show your path, how did you actually start preparing balancing between Harrison's general medicine and cardiology specialty from Harrison as well as from Brunwald, how much time was given to important topics versus high yield versus important, as we call high yield, as in pregnancy is like 40 pages, 20 pages, and you'll get two questions. So one question per 10 page versus ACS 400 pages and you get four questions, which is like one question in 100 page. So the ACS is the most important part, but you get low yield versus high yield, say general examination or cardiovascular examination, where you get small pages, you get more questions. So, when did you realize that aspect, and how did you prepare for these balancing out with medicine?
So Harrison I had gone through the cardiology part of Harrison to some extent in MBBS for final year exam as well, sir. And
Yeah,
again during my MD exam, I did prepare. I did study it for my final exam as well as when I saw the patients in the wards as well. So Braunwald, I used to refer to some parts like heart failure and some mechanisms of pericardial diseases and some specific topics as such. So with regards to the high yield topics like pregnancy and I just use the videos so that it could be concise in within 1 or 2 hours so that everything could be done quickly. So
right.
that yes.
For Brunwald, did you finish whole thing, or most of the students actually do is important topics, high yield topics, and then diagram table flow charts only, as you were mentioning? Was
No, so
that your strategy?
I didn't do the whole textbook. I did only
Right.
the some important topics as well as the images and the flowcharts.
Absolutely, and the rest of the videos anyway cover most of the stuff, right?
Yes.
Right. So, what was your approach? You would read a topic, then give a test, and then do the Q bank, or you do the Q bank, then read the topic, then give the test, or then first give the test, identify your weakness, then read the topic, and then so between the three, how would you juggle?
So I normally followed a pattern of studying the topic at once. I used to complete the
Okay.
topic, and around 2 to 3 weeks later, I used to go for the test so that it would be a
Okay.
revision as well as I'd know what I'm missing and what I can study more on. So
From
that helped
the
as well.
Q bank,
Yes, sir. QBank.
from the Q bank. Okay. And
Yes.
then grant test. When would that follow? Or
Grant
was it
test,
only in the end that you did grant test?
no, sir. From around from the month of March or April, I started giving all the grant tests which are available. So I used to
Okay.
give it regularly, irrespective of what rank that came up. I just made sure I gave all the tests that could be done.
Right.
Yes.
So initially, I'm sure the ranks would not be faring so great, and then in the later part, I could see Sudeep appearing in the Grand Test series. So, what was your motivation or drive, or was it discouraging to you to see that you're not doing great, or did it motivate you to do better? How was it?
It did discourage me a little, but I was more motivated for that, sir, because I wanted to do my DM in one of the premier institutes. So I was
Right.
kind of motivated for that, so that I could study the whole day without any.
Yeah.
I did feel lows, but it was more of highs.
Yeah, I usually say this because you'll always have 6 monthly exams. So there'll be some people who'll wash out ahead of you when you're appearing for GT for 1 year. The whole
Yes.
first chunk of 20, 30 people will go out and your rank jumps like 20, 30 ranks after. So this used to happen even when we were preparing for the entrances when, one big chunk will move out and your rank will jump. So that's a common way. So that's very important that you should not get discouraged when you're initially appearing. It should be a driver, as you very well mentioned, that Sudeep converted into an energy of motivation and drive to actually do better. So when you would do good in a test, would that make you complacent, or you will actually try to improve upon the topics that you identified where you've not done, and then go back to Brunwald or go back to videos? How would you, or just go back to QBank and prepare those questions more thoroughly? What was your approach for identifying your weaknesses and reinforcing them?
Initially, as soon as the test was done, I used to see the questions and see the explanation in the questions itself, sir. Then I used to go
Right,
back to the topics in Ronwald or some table of Harrison so that I could find something and then read accordingly.
right. And for the WhatsApp group that was there, where we used to put questions and some ECGs or some images,
Yes.
was that how was that helpful, or was that distraction? I mean, was that adding to the noise, or was it adding to the knowledge?
No, so that did help a lot because I think you had sent around 100 plus images
100
of
last
the.
images.
Yes, sir. So that helped a lot in quick revision as well as looking through the whole of whole of cardiology. It also helped in some of the guideline directed approach to the diseases as well. So those
Right.
really consume the topics in a single image, sir. That was very
Right.
helpful.
I forgot to mention those 100 images to the other two
Yes, sir.
interviewers. I should have taken your interview ahead of them. But yeah, I remember that I usually before 15 days or a week I post 100 important topics because cardiology is so wide. But at least knowing that you've done 100 important points, you're much confident. I think the same also holds true for important trials. Prior to the interview, I shared a list of top 10 trials of cardiology this year and top 20 trials of last
Yes,
decade.
yes, sir. The interview I had seen all the trials which you had mentioned and also attended the interview on Zoom as well, sir. So that was also very
Right.
helpful because you asked different questions to all of them so that it
Correct.
helped revise the topics as well as know what the examiner wants us to prepare for the interview.
Right. Yeah. So coming to your mock interviews, you did well in your mock interviews. I remember that as well because the other two candidates were at the fag end. So I had actually asked them the toughest of all questions. But for you, it was pretty much on the average side. So how was your experience with the mocks, and what do you think was the value of mock in actually preparing for the real interviews?
It did help, sir. Like I said, it helped me get the perspective of what could be asked, especially when you. My thesis was on nephrology, but still, when you ask questions about the thesis, so I knew that okay, this is what I might be asked in the interview as well.
And were
So
you
I did.
asked?
No, sir, I was not asked regarding my
Okay.
thesis. I was asked regarding my thesis, but not. anything related to cardiology on the same.
Right, right. I remember the other two candidates also, they were asked, and then they were asked in their exams questions related to their thesis. So it happens. Thesis is always asked to everybody, what was your thesis? And you can expect a question, you may not expect a question, but be prepared for it. Yeah. So, what was your exam attempting strategy? Were you targeting to attempt as many questions as you can in one go, or you were doing it in two round strategy? First go, finish, come back, come to the questions left, and then do it two. So, or and what was your target? Did you set a target that I'm going to attend these many, or you were like, I'll play safe type of strategy?
There's no specific target, sir, but I had kept a rough idea that at least 75 questions, irrespective of what happens, has to be answered. So I
Correct.
answered everything in one go, but I marked it for review
Okay.
in the initial round. I marked all the questions which I had doubt as a review, and then I went back to only the reviewed questions at the second round.
I think that's a good strategy. A lot of students actually do the mistake of, two round attempting strategy where they actually don't end up making good of either of the two rounds. So good strategy is that you go in one round, mark for review, and then come back to the review mark questions and then attempt to answer them. That's a good and easier strategy that we all have been trained from undergraduate days to appear. I mean, a lot of students as they proceed for SS or INI, they actually forget that strategy which they've been taught in the NEET UG, that
Yes,
this is the strategy. Don't do two attempt strategy. One attempt, mark for review, come back for review. That's how you save time. So that at least if the time is up, you actually end up getting marks for review, but submit marks that can be assessed for.
yes.
So how was your interview?
So interview did go well, sir. I was initially asked question about my like what was the thesis. That's it, and then they went to the topic proper of cardiology. So it was good. It was not very bad, but they did ask about a few trials which I was a little confused about. But otherwise, it went well, sir.
Great. So how do you rate doc tutorials, and how do you rate me as a faculty in cardiology?
Extremely good, sir. I did enjoy seeing all the videos that I was a part of, especially the previous year questions. I made sure for the
Oh
last at
yes,
least last 2 weeks I
UIC.
saw all the previous year questions as well as all the 100 images, and the
Oh,
question bank I solved all the questions that were there on the question bank, so that it was. Even because once you see in the exam, you feel that okay, I've seen this somewhere, so you're more confident when you are tuned to the questions.
right. So, final important closing tips for the students who are now pursuing final year of MD. How should they be targeting, say, INI June or April, or say next October 25? Those who are preparing, what should be their strategy?
So I'd suggest them to study cardiology alongside medicine for the final exams as well. So for cardiology, they could see
Tutorial.
as well as Dr. Drill's question bank as well. So that I feel is sufficient.
Right. And of course, be the part of WhatsApp group and appear for my
Yes,
mock
yes, sir,
interviews
definitely. WhatsApp
and
was very
question them.
useful. Even when everyone
Right.
else asked questions, it helped us a lot.
Right. So Dr. Sudeep was full course subscriber of doc tutorials, including videos, Q Bank, uh, GTs, as well as our WhatsApp group and mock interview sessions that he appeared for. So, Dr. Sudeep, congratulations for securing AIMS Merit List 3 and Common Merit List Rank 4. And it's always pleasure connecting. And I assure you that wherever there is a need that you need a mentor, I'm always there, just a call away.
Thanks a lot.
So stay connected. This does not end here, it begins here. That's what I tell most of my students. I look forward to mentor and be of any value or help that I can be in future. So best wishes and stay connected. Congratulations. Enjoy your success. Take care. Good night.
Thanks a lot, sir. Thank you, sir. Good night.